I think you mentioned in an earlier conversation we had how you were either planning or already doing some initial testing of actual microdosing in like very specific restricted places globally. Can you talk a little bit about that?
Yeah, you know, we're interested in mushrooms generally, and on the kind of physical and mental health side, that's functional mushrooms, but we're also interested in the mental health and frankly transformational aspects that psilocybin and psychedelic mushrooms can bring. And so a big part of what we want to do at Gwella is develop products and tools that can enable people to use these substances outside of a kind of medicalized clinical setting, but still in a way that it's kind of intentional and responsible, so you can get safe, effective, and measured use out of them and really get the kind of impacts that you want. So our plan has always been to put Mojo style products out in jurisdictions where we're able to right now. So there's a few around the world, the Netherlands, Jamaica, Brazil, and then plant strategic footprints and build out products on the functional side in lieu of or in advance of regulatory change in say North America or Europe. So that's always been on the agenda. Most people or most companies in the psychedelic space are really focusing on drug development or kind of putting out clinics. And then obviously there's some great companies that are, great content and education. We're obviously I'm not a drug developer and we're not clinicians, but aside from that not being our kind of core skill set, I'm really just interested in how these substances can be used outside of that really hyper-medicalized framework. And I think that's how most people encounter them now. I think that's how most people used to encounter them. And I think that's how most people are going to encounter them in the future. These substances have traditionally not been used for very specific medicalized use cases. In Eleusis, if someone had a cluster headache, they didn't say, let's get out the sacred brew and fix this cluster headache. It was really more socio-cultural, kind of transformational, semi-spiritual kind of institution that would help build a lot of the glue and building blocks of society. And they used to be used in those ways. And most people, I think, use them now still on the microdose side, are using them for creativity and cognitive health. And then on the macrodosing side, most people are using them to have awe and transformational experiences. And this whole mission has been, how do we build products and tools that help people go from a 0 to a +6 and not a -6 to a 0? How do we take relatively healthy people and give them the tools to elevate and optimize and improve rather than fix serious medical conditions? And that's not to say we're not super stoked about all of the great research that's been going on. And it's amazing that we're going to have these plant-based treatments and better treatment options for people that are suffering from PTSD and anxiety and depression. There's a lot of companies focusing on that, and Gwella's focus has always been, how do we focus on this, or how do we build tools in the more non-clinical setting? You could call it consumer, but it's not really recreational. It's something in between. I always think about what's the middle ground between going out there and rolling the dice with your buddies at the cabin and sitting in a kind of clinician's chair in a doctor's office. There's a middle ground there where you're using these substances in with the right set and setting, with the right intentions and all that pre and post work on integration, but you're not going through the hyper-medicalized framework for a specific kind of ailment that you're trying to fix. You're using these things to improve your state of mind and have a profound experience. And so our kind of first market that we'll be going into will be Jamaica, but we're also super interested in the Netherlands, where you can sell truffles legally. So there's a few things we're playing with, and we're playing with what we can stack them with. And there's a bunch of things that go on, say, the illicit market that have already experimented with different stacks and all that type of stuff. And there's the Stammet stack, and There's a whole bunch of things out there. We put it with ginger to help offset nausea and that kind of stuff. So we're really trying to build out quality consumer products that are, accessible, that are easy to take. The reason why we like gummies is because you just pop them in, they're easy to take, they're nice to take. And how do we avoid people having to munch down penis envy mushroom or drink a tea that doesn't taste so nice? So how do we build accessible products that work in a kind of metered and dosed way, so you know the impact, you know the kind of onset kind of time, and that are built in a way that you know what's in them, put out in markets where you can use them and we can sell them legally, so we can build up data and kind of audience sets and have a look at the impact and tweak it. And then as and when we can put these products out into other markets, we will.
It's fascinating. I think it's really interesting, what you said about, for the most part, what's out there in the psychedelic space now falls in one of those two camps you mentioned, either drug development or sort of clinics, right? And certainly from a brand perspective, some of these clinics have done a great job of branding and PR and things like that. But there hasn't yet been, for legal reasons, essentially, the opportunity for more of a quote unquote consumer brand to exist. But the other element of that I think is super powerful is the accessibility, right? So even for these clinics that are available to the public in many states in the US right now and in Canada, they're still extremely expensive, right? And a solution like this could potentially solve some of that problem as well. Do you have a sense of how these things might be priced and how accessible they will be?
Yeah, I mean, most of the time these products are made expensive by government regulation, depending on what the framework is. Growing mushrooms and mushrooms as a raw ingredient are incredibly cheap to develop. Now, obviously you'll have different stacks and packaging it up and all that kind of CPG stuff to think about, but there's really no reason outside of regulatory barriers to have these products be so expensive. And that's why in Canada, cannabis was quite expensive, or still is quite expensive compared to the black market. It's the regulations and kind of taxes. And even on the growing side early on, all the licensed producers had to have crazy security and safes to store things that cost, millions of dollars. And so that made them all, have to raise a bunch of money. That put the prices up. And so it just depends on how this rolls out. But let's say we put out our product in Jamaica, they really shouldn't be. It'll be relatively comparable to what you can buy that's on the illicit market. I would think Mojo is going to be about $20 for 10 gummies. We're not pricing these super expensive. And a core of what we are trying to do, what we talked about, is have accessibility. We want more people. We want the products to be accessible and usable and nice and have friendly branding and all of that stuff. But we want these products to be accessible. I think if more people can get the benefit from kind of plant-based substitutes on the kind of health and wellness side, the better. And then more people can get access to these transformational experiences, the better. So as a company, we're all about how do we try and get more people to have these experiences in a responsible way. And we're the opposite of, say, IP bombing every use case or combination of drugs out there. I mean, we really want open access. I think we'd all benefit from fairly decentralized companies that put these products out, so not controlled by a few large pharma players.